This is Dr. Yanik, and I'm speaking to you about my JBJS article, Identification of a Novel Genetic Marker for Risk of Degenerative Rotator Cuff Disease Surgery in the UK Biobank. My research team conducted this study because there's been a lot of interest in uncovering the genetic determinants of degenerative rotator cuff disease, in the hopes that we can better understand patient susceptibility to tears, as well as a patient's potential for a favorable surgical outcome. But there have been very few studies that are large enough to examine a broad array of possible genetic markers. We used the UK Biobank, a large cohort of 500,000 people in the UK, for our study. While this resource provided a large population with extensive genetic data and linked information on hospitalizations, we were limited in not having access to shoulder imaging data. As a result, we focused on rotator cuff surgery cases and used several criteria to optimize our identification of degenerative rotator cuff disease, which include looking at coded diagnoses, procedures, and provider specialties. After conducting a genome-wide association study using this data, we identified a novel association between a genetic marker in the CREB5 gene and incident degenerative rotator cuff disease surgery. CREB5 is a transcription factor that may influence inflammatory responses. At the same time, we found that most genetic markers identified in prior studies did not replicate in our population. This could be due to differences in our case definitions, specifically that we focus on surgical cases. However, it is also possible that many of these prior genetic findings were chance associations, as many have not yet been replicated in independent populations. Continued genetic investigations of rotator cuff disease in other populations will be important to allow identification of replicable associations with genetic markers, particularly other large biobanks that may be more diverse than the UK population. These markers can then be studied in a more focused manner to understand their influence on rotator cuff disease progression and outcomes after surgical treatment.